Awesome. Hi, guys. Hi, everyone. Good day. And wherever I don't like to say good morning, good afternoon, but wherever you're listening to this podcast at any time, I hope you're doing well and I hope you're fine. My name is Izine again, and I'm your host of the HSB Podcast series. Today, we are on the Market and Startup Spotlight series, and I'm very, very excited to, have yet another builder who is actually taking on the challenge of, solving the problem of healthcare access in Nairobi. And I have no other person than Wilfred. And I'm sure you probably have heard his name somewhere, you probably have read about him, I have no other person than Wilfred Njuguna. Yeah. He's a builder for health in the Nairobi market, and solving for pharmaceutical market pharmaceutical access to medicines. And so I'm pretty excited to have him on the podcast today. So just sit back, relax as we talk about the market in Nairobi and what Wilfred and his team have taken on. So hi, Wilfred. It's really nice to have you
Hi.
here. Thank you for the opportunity to learn from you and also see what you're doing to spotlight your business for founders and people who are going to listen to this podcast series. So I'd like to know a little bit more about you. And, can you tell us a little bit about Wilfred? Who is Wilfred in general? Yeah.
Thank you. Thank you for the opportunity, Ezine. My name is Wilfred Chege. I'm a builder based out of Nairobi, Kenya, and I'm a two-time founder. I'm with over 10 years experience in venture building. Exited my first business around the COVID time, and it had a silver lining because around the same time is when I stumbled on my second business through my co-founder called Dr. Victor Choka. At the time, we were solving for a marketplace access for pharmaceuticals because there was a curfew, and being a health pandemic, there was a need for people to access medications even past curfew hours. And this is what ballooned 3 years into a platform that is enabling neighborhood pharmacies to sell online. And I'm happy to be here.
Yeah, really happy. Wow, I didn't even know that fact that you're a two-time founder and you have an exited business. I think we need to give you your flowers. That's definitely really amazing. So
Thank
thank you,
you.
Wilfred. I read your story and I was like, oh, you started your entrepreneurial journey at a very young age. I think you started that when you were still in secondary school or something like that. Where did you get that vibe from? Where did you learn that entrepreneurial? You think it's something that you just found, or you saw people around you that kind of modeled that to you?
Yeah. So I don't come actually from an entrepreneurial upbringing. So this is something that I actually also stumbled into in high school. There was a company program run by Junior Achievement, which is a global movement where they enable or give students an opportunity to co-create a company under their umbrella, test it out within the school ecosystem, and then compete their results. So who had the most sales, which was the most innovative idea. And this was my introduction to entrepreneurship, and I really found that this was something I was vibing with. So I never let go of it, and I actually took it on head on from that particular moment, because the same idea that we competed with, we ended up being the first runners up in the country, and I went on with the same idea, built it all through campus, and so far I think 10 years down, I'm still on the same.
So mantra is catch them young, right? While they're
Yes,
still
yes.
very young, catch them. You never know. I think I really love that. I had to write it down because finding young people and just building in them. Because I think at least for the African continent, we need to begin to think about job creation, and just from that early stage to prime the mind of people to say, okay, you can be the business owner, you can be the entrepreneur, and that's definitely no wonder you still keep this vibe and this energy in building for health. So yeah, thanks Wilfred for that very nice introduction, and I'm very excited to have you here on the podcast because I think for me, anytime I get to meet a founder or builder in health, I'm always very excited beyond just learning from their experience, but just also appreciating the work that they do in saving lives, right? I want to start from the beginning, all right? I want us to go back to the drawing board of when you chose to build for health, like Zendawa healthcare business. Why? I mean, I would like to know a little bit about your background. Why did you choose to do something in healthcare? Why, obviously why? Let's go to the question. Why? Why did you choose to build this?
Yeah. So I think it was a full circle moment during the COVID period, because previously we had some conditions that we were managing in my immediate family. And access to medicines was something that I had grown up witnessing, because most of the time prescriptions need to be updated. There are regular stockouts, and this was a condition that required continuous medication. So this is something that I had felt all through. And then during the COVID period, when my co-founder actually approached me, I saw that what I had experienced for the longest time was now becoming a felt need to everybody, and more of an emergency fashion, because they could not access medications past curfew hours. And even worse yet is the medications required, they didn't have any visibility into where they could actually get them, because the whole supply chain had been affected. So for me, it became a full circle moment, and I didn't hesitate when I saw the opportunity to actually improve access. And at the time, it was a very simple solution, building out a marketplace for the retail segment of my co-founder, who has been running community pharmacies, I think, for around 20 years now. So through this simple marketplace, we could be able to dispense medicines even past curfew hours, because our couriers were branded as essential service providers, so they could work outside the curfew hours. And when the curfew was lifted, I was able to sit down with my co-founder, and we identified that nobody's actually looking at neighborhood pharmacies as a connected ecosystem by virtue of the value they give. At that particular level, they're independent, they're fragmented, they're supposed to, scratch the surface individually, even though that is the first line where pharmaceuticals are being dispensed. They account for more than 80% of where we get drugs from the continent.
Yeah.
So having this insight really actually gave me that, that eureka moment that somebody has to look at these fragmented and independent pharmacies as a layer that can be connected by the virtue of the value that they bring to the whole supply chain. And that's how Zendawa came to be.
Wow, that's amazing. Wow, it feels like almost every founder I've found or spoken to lately have, found that the COVID-19 was like a validation of the need of a lot of the healthcare solutions and health tech solutions we have. But definitely, I think even beyond the COVID-19, like you said, access to medicine has always been one big challenge, right? And even me talking as a pharmacist, I know that even before the COVID happened, right? While a lot of small retail pharmacies are really struggling in getting stock, right? Getting stock for their commodity, getting to know where the supply chain, basically just really understanding the entire ecosystem. And I know that this is a gap, or this is a need, not just in Nairobi, but, across the continent. But thank you for just telling us your why. I always like to ask people their why, because I think it's very important to know where you're coming from, why you choose to stay, because obviously for some reason, when the journey gets going, right, you have to really understand, why did I even start this, right? So thank you for sharing with us, what you are doing in Zendawa. So I think it seems like you guys are trying to build the solve for the problem of distribution, affordability, and access, right? How would you say your model has changed, right, from the inception of when you guys started, or would you say it has kind of stayed the same, right, in terms of like how you've approached this? Sorry. How you've approached these challenges, right? How you've approached these challenges of, access, affordability, and, distribution.
Yeah. So as mentioned, the onset was a very simple solution. So it was just an online storefront for a retail segment. But what we realized when now we were approaching this as a bigger, challenge for every pharmacy, we realized that we had to do the work of building the infrastructure first, because before you tell a pharmacy to sell online, they're having stockouts within the pharmacy itself. They're having challenges with cash leakages. They're having challenges with access to finance. And all these marries into, facilitation into the online segment, because I normally tend to say customer shopping online are very unforgiving. You don't like to go to a shop and find that you can't get something, or you order for something and then you're told, would you rather get this? And that is something that actually is how things work on the ground. So you go into a pharmacy and you're told, we don't have this X, can we replace it for you with a generic medicine? But that behavior being transcended into the online pharmacy space, you find that customers are very unforgiving about it. So we looked at this with a deeper lens just to identify how we can be able to bring better efficiency operational wise for these brick and mortar pharmacies, so that once we transcend them into now the online pharmacy space, they will be able to give a customer satisfaction for anybody who would want to get their services. So that is how our model has evolved. It evolved from just a simple marketplace to now having three pillars. And the three pillars that we offer are now embedded financing, pharmacy business management, and now the telepharmacy element. So with the pharmacy business management, they're able to get a POS where they're able to digitize the operations, seal any cash leakages, manage their inventory, manage their workforce. And once they have a proper operating business, we're able to use this data to unlock for them embedded financing. And with embedded financing, we're solving for the issue of stockouts, so that now finally when we unlock them as a telepharmacy partner, when you're on the Zendawa app and you're asking for medicines and the algorithm matches it to one of the pharmacies in our network, you're sure that the medicine being ordered for is present and the workforce is operating optimally such that there is operational efficiency. So that's how our model has evolved over time.
Wow, that's pretty amazing. So I'd like to understand, you guys operate a B2B model and a B2C model, right? So basically, is it the both or just...
Yeah, so we normally tend to say that the B2C element is still a service to our pharmacies. So it's just a market linkage. It's the same way Shopify can give you, your own site for your end users to access you, but Shopify's service and focus is to their businesses. So it's kind of the same model. So our B2C element is just as a service to the pharmacies that we're operating.
That's amazing. And definitely it's all interconnected. I like to say something about when you throw a pebble in the water, it creates a
Yeah,
ripple effect, right? So it
yeah,
touches
yeah,
everyone at the end of the day. So great,
yeah.
great and amazing work that Zendawa is doing. And I've seen that, you guys are really doing an amazing 820 partner pharmacy. I know definitely that's not the easy task to do, right? To onboard people, client acquisition, onboarding new customers and helping them to see the value of what you're doing. So great, great, great work, that Zendawa has done and is still doing in the country of Nairobi. Really, pretty want to move on to the next question, which is like kind of like really understanding the market in Nairobi. Like, can you like just give us a snapshot of what what the healthcare, access market looks like? Was the private sector divide? Basically like we would love to hear a little bit about what the uniqueness of the Nairobi market is.
Yeah. Nairobi is actually the city.
Okay, Kenya, right?
Well, okay, yeah. So again, we're not yet touching every corner, so it's still relevant to mention Nairobi. But how the market works here is you find that 66% of primary caregivers are actually pharmacists. So you have up to 40% of the population going pharmacies as their first point of interaction when it comes to ailment. So if you put that into statistics, in every household of 10, you'll have 4 people going into a pharmacy first to inquire about how they can treat themselves based on different symptoms that are coming up. And when it comes to financing, you find that there's only about 2 to 3% of insurance penetration, but the government is trying to really do a lot with Social Health Authority, which is just basically a fund instituted where they're trying to bring everybody on board, especially those who are in the formal sector. But if you're in the informal sector, you have to make the contribution yourself. So you see, just with 2 to 3% insurance penetration, most of the spend in healthcare is still out of pocket. And this creates a huge burden because you can't compare healthcare for somebody earning less than 100, give it $100 a day, not a day, a month, $100 a month, to spend out of pocket on healthcare. So we have been trying to see how we can be able to improve this, because after you get the diagnosis from the doctor, what actually makes you better is if you have access to the drugs, because even if you have the diagnosis from the doctor, it doesn't help if you can't access the medications. So that's one of the primary areas that we are looking at. hopefully with our model at the economies, when we're really able to leverage on like economies of scale, we will have an impact into, this, the affordability of medicines, given that the huge spend is still out of pocket.
Wow. Definitely. Like, this is really amazing. I think the healthcare market in Nairobi, in Kenya, is kind of very similar to Nigeria and, some of the other African countries, because we have a very, over reliance on pharmacies as the first point of primary care, right? And, I think that's an opportunity that a lot of founders, a lot of founder donors are actually looking at. How do we, take pharmacies to become the first point? How do we empower them to be the first point of care and to deliver primary care to the population? So great work, and thank you for helping us, though. At least now I know a little bit about the Nairobi market. 2 to 3% insurance coverage, which is very low. I was thinking it's actually going to be better than Nigeria, because Nigeria is like, I think we're about 5-7%, but I think they are trying to do, so I think it's kind of very similar across the different markets in Africa. So thank you for sharing that. So really, I want to go, let's just chat a little bit about, how your journey has been in building Zendawa. I think I asked you this offline, but can you tell us the name, like just a little bit about the name Zendawa, how, that came about?
Yeah. So Zendawa, it has the first bit of the name is actually an acquired taste from the Japanese culture, where Zen culturally is identified with awakening. And then the second part, Dawa, means medicine. So this is actually our North Star, where we're trying to bring an awakening into reinventing how the supply chain works, because I believe now also coming back to the question of how the journey has been. Healthcare, I think even when it comes to financing, you find that people are a little bit shy because, you don't want to make profit from, people getting sick. But in truth, I believe that if there is an efficient model, there is a way that there can be good returns at scale without necessarily having the element of exploitation that you find in other tech verticals or in other verticals. So I think that is one of the things that I've witnessed building Zendawa. And I'm sure there's room for improvement, especially if you're saying this and you're a financer. I just think the supply chain needs a little bit of tweaking just to be more inclusive. And once the margins are spread out across, I believe there would be substantial take without necessarily having an exploitative element.
Wow. I think that's very, very, now that you brought it up, that's something that I'm also very, excited about. And that's sort of why we started the HSB podcast, really, to really talk about the business of health, because oftentimes people forget that running a business is a business, right? Regardless of whether it's healthcare, whether it's fintech, whether it's agriculture, it's a business, right? And oftentimes we see people faulting, a lot of, I remember during my MBA at Johns Hopkins, and, one of the debates we had in class, one of the case studies we had was, is healthcare a right or is it a privilege? And, I sat down all my life, as someone working on the field in market access, I've always said healthcare is a right. You must have healthcare, blah, 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 blah. But, operating a business is actually a business. And if you're not making profit, so the social divide and also the altruistic, like also the good, the business side needs to be balanced, right? I think that is where a lot of healthcare entrepreneurs are really struggling, because in the process of trying to do good, they forget that they're actually operating a business. And, I'm really glad that you mentioned that, because even when you want to do the good, I don't know if people exploit it, but people really need to, I think what the hard and fast of what I'm trying to say is that people really need to understand that running a healthcare business is actually business. And for it to be sustainable, for the quality of care to still remain optimal, and for the delivery of your service to be seamless, you need to understand that business owners in healthcare are actually in need of they're finding striking the right profit margin and all to keep that business sustaining. So I thank you for, spotlighting that, because I think that's something we need to keep echoing, that running a
Yeah.
business is actually a business.
Yeah.
So I know that you are actually, in the era where we're having a lot of buzzwords around AI, and technology and all of those sort of stuff. I know you've studied this quite a long time, because I read your articles with Microsoft. I was like, wow, this is pretty amazing. So I pretty want you to, I just want you to spotlight that a little bit, of how you've been able to ingrain technology. I know you have a background in IT, and luckily you have a co-founder who is also, technically sound in the pharmaceutical business, right? So how do you think that has played a role in, also skilling access for healthcare in Kenya and even beyond?
Yeah. Um, so for me, I think having the North Star as just creating more efficiency within the supply chain and building for the pharmacist fast has really given us clarity in regards to, the developments and how we are applying technology. And in regards to AI now, what we've seen is many of the pharmacies have the need to scale up, but given the traditional way of operating, it's very capital intensive, for lack of a better word, both in setting up space, in employee overheads and employee payroll, sorry, and management overheads, because utility of one shop is not the utility of 5 different shops.
Collaboration, I guess, in terms of how you've been able to scale your business and some of the lessons you've learned, like the credibility currency of your, co-founder, your partner in the business. Okay, so yeah, I think just to keep up the momentum, let's just wrap this up. So how would you say collaboration and cross-sector collaboration has played a role in the business you're doing with Zendawa, right? I mean, it doesn't have to be specific, but for potential investors that might be listening to us today, you never know. What would you say that collaboration can look like in terms of like both the ones you have, those ones you're looking out for, and that's important.
Yeah, I think this FHIR has really helped, which is the standardization framework for annotating data so that data sets can be able to communicate to each other, systems can be able to communicate with each other because data sets are labeled in the same fashion. So I believe this is the most crucial element to collaboration, and the policies have been laid out. And I think it's just up to us, builders and organization, to actually take it up, because once these data sets are able to communicate to each other, or these systems are able to communicate with each other because of data sets labeled in the right fashion, the next step will be to create a sandbox where everybody just lists their APIs and you can be able to quickly integrate and roll out solutions without necessarily going through the bureaucracy of needing to know who's running this institution. I think once that happens, we will have the utopia of building, because you would be able to quickly integrate, quickly communicate without any friction. So that is how I think the future would look like versus what the ecosystem has done so far. And I can't complain in regards to policies. There are a lot of bodies that are sitting every day to ensure that these collaborative frameworks are being fashioned in the right manner. Just because I believe even without the financing element, solutions should pay for themselves. I'm a big advocate of that. And there's a lot of testing that goes into products that people actually want. So collaboration for me would be, once we've eliminated the friction of actually testing out solutions and rolling out new features quickly, and would actually mature the ecosystem and bring returns, because people will actually be paying for these solutions. And like in any industry, the finances come when there's a solid, return on investment path. Even if it's, live along the impact first organizations, just having that route to market where people are paying for actually these features and solutions that you're building is how I see the collaboration actually having an impactful sense in the long term in regards to what you're currently doing.
Wow, that's definitely really exciting because I've been hearing a lot about the sandbox technology that, a lot of different founders who have had so far have mentioned. I'm probably going to look into what you mentioned, but I think that would really go a long way, in terms of like helping that collaboration happen seamlessly and helping you founders focus on, where the value is. I think it will also create a sort of competition. So obviously, those who are more innovative and have have the customer service, but definitely I think that really really help in anyone who's building anything in the health technology space. So thank you for sharing that. So for any potential investors that is probably going to listen to this or pop on this at any point, how do you think they can reach out to Zendawa? What area are you guys open to investment? Basically.
Yeah, we're always open to partnerships because this is a felt, this is a felt need. This is a felt solution. We're building for real people with real challenges. So we are always willing to engage potential funders, collaborators. And I am accessible via Wilfred at Zendawa.Africa. You should ping me on email. That is my personal direct line to myself. And we can be able to have a conversation regardless of the sphere of how you see us advancing this mission.
Amazing, amazing. And everyone definitely, as you can see, Wilfred is a two-time founder, but beyond that, I think just the conversation between us, I can see that he's very rooted in trying to solving this, not trying to solving this, because he's already done this with 820 partners. Go and try it. I used to say something, be easy, go run now. Because even just onboarding a single pharmacy must, it takes a lot of grit, takes a lot of resilience, and also that energy inside you to continue to do what you're doing. So I really want to commend you again for what you mentioned a little bit about policies and having enabling environment, right? Let's move beyond the country, Kenya, right? How do you think for anyone who is obviously everyone is saying Africa is the future of innovation, Africa is the future market. What's your perspective about that? You that you are building in Africa, do you think that is true? And how would you say, what would you say to someone who is looking to come into Africa to come into this kind of space in health technology?
Yeah. Unfortunately, we have 54 countries, and building for each country is building for a different market. That
Yeah.
is what I can say. And at the policy level, there has been some conversation around this in fintech of having a fintech passport where this solution, if it applies in Kenya and it's licensed in Kenya, the same license can apply in the reciprocating country. So you don't need to, like the conversation ongoing is with Rwanda. So our fintech registered in Kenya can go and operate using the same license in Rwanda. So this would be amazing for healthcare because if I don't have to register, have to have a license in all the 54 countries, then it really, really reduces both capital and operational overheads when it comes to, trying to expand the solution and reach more countries geographically. So I think that's what I would tell anybody looking to come in. Where we're currently at, it's 54 different markets, 54 different languages most of the time, 54 different spending patterns. So you have to really brace yourself for that. But there is room for improvement learning from other sectors.
It reminds me, I had a podcast with a founder also who has one of his business. He's operating in 5 different countries, but he's also in Kenya. And one of the things he was saying was, that just even understanding the language barrier, right? Somebody speaks Swahili, the other person doesn't speak Swahili, and the someone speaks French. It's actually something Africa is not just one country, it's actually 54 countries. So definitely having that ingrained understanding, speaking to people like myself and Wilfred who are, on the ground, having that local context will probably help.
Yeah.
So thank you so much for sharing that. I really, really appreciate your journey and what you guys have built in Zendawa AI. Is it Zendawa AI or Zendawa Health? And how you're tackling the problem of financing of pharmacies, retail stores, and also stock management of pharmaceutical supply. All right, so now I'm going to talk about your team. What does it look like building and managing your team? And what will I say? And what will you say are some of your biggest lessons in this journey so far?
We're not a very huge team, luckily, if I should say. We're all very grounded. We're all very grounded in this for the long term. And I think we contribute more of our personal lives into the business. And I tend to think I don't lead, more of the quartermaster, so the taxman, if I should say, in the sense of what we need to sacrifice at this particular point. So I just tend to make it really clear that for us to move from this particular milestone to the next particular milestone, this is what we need to sacrifice. And how that, just how to tone that and how to motivate the team to make those sacrifices is actually most of what I do, because I believe inherently everyone kind of has a leader in them, or in a fashion. I think leadership came from the Roman times because there was a lot of politics and socialism involved in regards to like social classes, not socialism. Because I've found that when people are motivated to do something, you don't need to lead them. You just need to make them know what they're, getting themselves into. So that's what mostly I do. And of course, I didn't start out like this. It's been years of learning and relearning and just building on, the different leadership styles, for lack of a better word, that have not worked and what has worked so far. And that is how we are currently running Zendawa. And I just hope it can remain the same. I know it can't because we are a growing organization. Cultural wise, is how
Interesting.
culturally want to maintain the same fashion when it comes to motivating and just scaling out and building.
Wow, that's amazing. And, obviously, I think just having that mindset that, having builders on your team, because oftentimes you think that's only the founder that is builder, but having people who have that mindset of, oh, actually, we are doing this to save life. And, you said something very important, finding their intrinsic motivations, finding the extrinsic, finding the right motivations for your team is definitely really, really what's definitely, and it sounds like you're a very great leader, even just you echoing that out. Yeah, so I know leadership is definitely not an easy task because I myself am a leader in my own right, in my own small capacity. How much more you who is managing over 120 partner pharmacies across, Kenya. I'm curious, how many regions in Kenya are you spread currently? Are you
Yeah, yeah. There are three particular regions within Kenya.
so you're in all three? Wow.
Yeah.
Wow, definitely you have made a lot of personal sacrifices. And definitely we need to commend you for all the sacrifices you're making in saving lives. Definitely not an easy journey to be a founder. I think, it takes a lot from you. All these founders the one I spoke to last week, he mentioned that that if he could do it again, he's not gonna do it, but he's just there, find the fulfillment he finds in his team. He has over 1,000 staffs. I'm like, it takes a lot of builders, to build, but definitely you're doing something great and helping to save lives that you even know not of. So I'm curious, I'm sure there are days where you're like, I'm tired, I don't want to do this anymore, or this is becoming very exhausting. What keeps you going? And, I used to ask my founders that this last question as we wrap up the podcast. What is your favorite quote or mantra that, when you think of or when you remember, it keeps you going, it makes you stay on this journey? Because I'm sure I don't know about you, but I'm sure there are days where you're like, "Ah, am I the only one? I don't want to, What's that thing that keeps you going?"
For me, it's actually something that I think you've heard of like for the last 50 or so years. Is this Rome was not built in a day, and this is something I had to hammer down into myself because most of the time I find that the battle is within. Nobody is telling us to solve world hunger today. Nobody is telling us to, find the cure for cancer today. But as a founder, you're the one who sets those timelines for yourself. So if you're rolling out to pharmacies, you're the one who says, I'm going to roll out to 5,000 pharmacies in the next 2 months. Nobody whips you and tells you that you're supposed to do that. So for me, it's just telling myself that Rome was not built in a day and taking that step, you know, that one step forward and also just pacing myself appropriately. So that mantra, when everything seems, like it's all over the place, I'm burnt out, just remind myself that Rome was not built in a day and nobody is whipping me to actually solve for every pharmacy on the continent tomorrow. So this enables me to take some time out, go for a walk, go for a stretch, knowing that when I come back, I'll still have the same challenge to solve and I'd be more energized to do so.
Definitely, Rome was not built in a day. I thank you for sharing. I should tell myself that too, because oftentimes as founders we think that we need to get it all done and all going, but just pacing yourself, finding, because if you don't take care of yourself,
Mm,
the vision is not going to be sustainable.
yeah,
So thank you for sharing. I think that's a good reminder for every founder that Rome was not built in a day. And you can solve the whole problem. Oftentimes you say, I want to take the whole market share. Sometimes even just 10% of the market share, and knowing that you're touching lives is actually the. So thank you for that, warm reminder. Rome was not built in a
yeah,
day. This has been a really exciting session, Wilfred, and I want to thank you for the opportunity to learn from you, also to learn about what you're building for health in, Kenya. And I'm rooting for your success. And at any time you're looking to scale or to need support or anything, just I'm here to support you in any way. And I'm really, really excited about how you've been able to put the market not just in Africa, but spotlighting it in the globe, right? In terms of like your face, how you're showing up, right? I really, really appreciate it. I want to go back to what you had said about storytelling, about telling stories about what you're doing. I think that is really, really what's saying, because you've done a great job. When I checked you online, I was like, okay. This is really good, So thank you for, constantly putting the country and the continent in a good spotlight, out there in building for healthcare. And yeah, this has been a really, really amazing session. Thank you to everyone who's going to listen to this. I think if you want to reach out to, how do we get to meet you? LinkedIn or email?
yeah.
What's best way?
So I gave my email wilfred@zendawa.africa. I'm also very active on LinkedIn. If you search for Wilfred Chege, you'll see a guy with a very big Zendawa banner in the background. So that's me. You can just shoot me a DM and we can get a conversation going.
Absolutely. Please reach out to Wilfred, support what he's doing if you're in Nairobi, or if you're an investor that's looking to invest in the pharmaceutical, supply chain space in any part of Africa. I think Wilfred has already built a reputation in these, onboarding over 800 pharmacies in the markets of Nairobi. I think, it's definitely worth learning from him and also supporting what he's doing, because we can do more to save lives and giving people access to life-saving medicines, just by partnering and collaboration. And so I think that's what I've been saying for the past 3 months. We need to improve the collaboration culture, right? In Africa. One founder who is building this, how do you support them? How do you, without even, basically, let's not stay in silos. Let's support each other, even as we build for healthcare. So thank you everyone for this such amazing session. Again, my name is Izine, and I am, someone who is very fascinated about healthcare businesses and supporting healthcare business leaders across the globe. And this has been a really fantastic session today with Wilfred. So stay tuned, stay connected, and remember, healthcare is serious business. Thank you everyone, and do have a great rest of your day. Bye guys.
Bye.